Hey everyone, and welcome back. Today, we're talking about something most men don't even think about until something goes wrong, the prostate. I'm talking about things like having trouble peeing, waking up constantly throughout the night, a weak stream, or even changes that could point to something more serious, like cancer. So today, we're going to break down exactly what the prostate does, why it changes as we get older, and most importantly, what you can do to protect it. So, what is the prostate really? It's a small gland, about the size of a walnut, and is part of the male reproductive system. It sits right below your bladder and wraps around the urethra, which is the tube that carries urine out of your body. Its main job is to produce a special fluid that becomes a key part of semen. This fluid helps nourish and transport sperm. Now, because the urethra runs straight through the middle of the prostate, any change in the size or shape of this gland can directly mess with your urination. That's why prostate problems often show up as bathroom issues long before you notice anything else. To really get it, you need to know that the prostate isn't just one solid thing. It's made up of three main zones: the transition zone, the central zone, and the peripheral zone. Inside these zones, you have a bunch of glands and ducts, all surrounded by muscle and fibrous tissue. Why does this matter? Because different prostate diseases tend to start in different zones, and understanding this is a huge piece of the puzzle when it comes to your prostate health. So what makes the prostate change and grow? It mostly comes down to one hormone, testosterone. But here's the twist. Inside the prostate, an enzyme converts testosterone into a much more powerful hormone called dihydrotestosterone or DHT. DHT is what really fuels prostate cell growth. As men age, a hormonal shift happens. Testosterone levels gradually drop, but DHT can stay high, and estrogen levels might even rise a little. This combination creates the perfect storm inside the prostate, setting the stage for enlargement and, in some cases, even cancer. Now let's talk about one of the most common conditions men face, BPH, which stands for benign prostatic hyperplasia. Benign means it's not cancer. BPH usually starts in that inner transition zone we talked about. The cells there start to multiply, forming little nodules that push inward. As the prostate gets bigger, it starts to squeeze the urethra, almost like a clamp tightening around a hose. This is what causes those classic symptoms: a slow or weak urine stream, trouble getting started, feeling like your bladder isn't quite empty even after you've just gone, waking up frequently at night to pee, and a sudden urgent need to go, sometimes with a little dribbling afterward. The good news is BPH is not cancer and won't turn into cancer. But if you don't get it treated, it can seriously mess with your quality of life. Okay, now for the more serious topic: prostate cancer. Unlike BPH, prostate cancer usually begins in a different area, the peripheral zone, which is the outer part of the gland. This is a crucial point because it explains why early prostate cancer often has no urinary symptoms at all. The tumor is growing outward, away from the urethra, not squeezing it. So, how does it start? It begins when certain gland cells mutate. They lose their normal growth controls and start dividing like crazy. These malignant cells form tumors that can eventually get big enough to press on the urethra, but they can also invade nearby tissues or even spread to other parts of the body, like your bones or lymph nodes. If it's not caught and treated, it can become life-threatening. This is exactly why regular screening is so important, especially for men over 50, or even over 40 if you have a family history of prostate cancer. Early detection is everything. So what can be done? For BPH, treatment often starts with medications. One of the most effective types are called 5-alpha ductase inhibitors. These drugs work by blocking the enzyme that turns testosterone into that powerful DHT. With less DHT, there's less fuel for growth, and over a few months, the prostate can actually start to shrink. For more severe cases of BPH, there are procedures like TURP, which is a surgery to remove the excess prostate tissue and open up the urethra again, restoring normal urine flow. For prostate cancer, The treatment really depends on the stage of the cancer, your age, and your overall health. Options can include surgery to remove the entire prostate, radiation therapy to kill the cancer cells, and hormone therapy which lowers testosterone levels to starve the cancer. For more advanced cases, chemotherapy might be used. There are also newer, targeted, and minimally invasive procedures becoming available. The most important thing to remember is that when it's caught early, prostate cancer is one of the most treatable cancers in men. So here's the bottom line: your prostate will change as you age. Some of these changes are normal, but others can be dangerous. Being informed is the first step to being prepared. If you're experiencing any of those urinary symptoms we discussed, don't just ignore them or write them off as a normal part of getting older. And if you're a man over 40, it is time to have a conversation with your doctor about your prostate health and whether screening is right for you. Taking action early can make all the difference. If you found this video helpful, please hit that subscribe button. Your support helps us get this potentially life-saving information out to more people. Thanks for watching, and we'll see you next time.